Well, my name is Karen Nibler, and I've been a league member in Corvallis for, maybe 28 years or so, maybe longer, no, like 30 years, I think. Because it was around 75 to 77, I think, is when I joined in that time frame. And I had little kids, and I didn't join until they went to school, because then I had more time. I was very involved in town and some of the social service agencies before I joined the league. And I've really followed that through all the way, too. And one thing I've noticed about league members locally is a lot of them are involved in 2 or 3 different organizations. So they have a lot of demands on their time. So they don't have just the league, to pay attention to. They have other organizations, too. So they're really very involved people that are involved in their community in more than one way. And of course I went to work. And so I worked for 20 years. So during the time that I worked, I didn't have as much time to spend on league activities, but I did follow through on some things that I did professionally, because I was a juvenile court counselor. So I followed the juvenile field and what was happening in that, and set up some programs locally. And then when I retired, of course, the minute I retired, I was fair game, so so they asked me to be president. So I ended up being president for 3 or 4 years. And during that time, I set up a lot of general meetings, which was a little different because they were doing a lot of unit meetings in people's homes before that. But I liked getting into some subjects and having a public meeting where you brought different people that were involved in certain areas in. And we did programs on energy and, some things that I knew absolutely nothing about, but it forced me to learn those things. And it really resonated well with the public. So we have a fairly good following for our public meetings. People know they're going to learn something, and we try to do fairly timely topics. So we started doing general meetings, and I think we've grown in membership in comparison to some of the leagues in other parts of the state, and I think that's one of the reasons is that we have those big general meetings. After I started being local president, I was also interested in following some of the state issues, the juvenile justice issues. And so in 2003, the end of the session, I started going to hearings because they were having what they called special sessions at that time. And that 2001-2003 had 5 special sessions. It might even have had 6, because I think they had 1 after the next session started already. So there were budget adjustments. So I learned early on that you had to pay attention to the budget. And you go to the budget meetings so you can figure out what state services are going to be funded and which ones aren't. And I also followed judiciary because that's what handled juvenile issues and public safety issues. And so that's kind of where I started off with the League of Women Voters of Oregon. And so I did the public safety portfolio and the human services portfolio for a while. And then the person who was the social policy coordinator resigned, so I volunteered. I can't believe I did that, to be the coordinator, which meant that I had to pay attention also to the medical field, and then there was all the healthcare reform that came up. So it became like a job. So here I was doing what I had seen other people do before, is that you get totally involved in this. I mean, to follow all of the public safety, juvenile, adult things, Oregon Youth Authority, Department of Corrections, and some of the judicial issues. I mean, and that involved like 5 committees right there, if not more. And then to be involved in all the human services things which were like children's child welfare and family welfare, the TANF program, which is temporary assistance for needy families. Those things, and then senior issues, senior and disabled issues, are all under Human Services. There's something like from 7 to 10 hearings, committee meetings that involve social policy. So to keep track of all of this is impossible. But I just try to keep a track of it as much as I can, and try to decide what are the most important things to track. In the healthcare area in the new Oregon Health Authority, mental health is going to be part of the Oregon Health Authority, and substance abuse will also be part of it. And that's a major area of concern right now because there aren't enough mental health services in the communities, and there are a lot of people who don't have services because they don't qualify for the health plan or they don't apply. And they end up in jails or in the hospital emergency rooms, but they don't have a lot of follow-up or treatment. And sometimes they're not willing to get treatment. So here's the police, and local agencies trying to deal with people who really need mental health treatment. So this is a major need, and there's a big controversy at the state level about whether to build another state hospital for the mentally ill or to build regional facilities. And they have built regional facilities locally for people leaving the hospital, but they really don't have regional facilities for crisis things before they go to the state hospital. And it's expensive to run. So, and insurance doesn't always pay for that, or they don't have insurance. So a lot of hospitals don't want to have mental health units because they lose money on it. So anyway, this is a huge issue right now, and they're going to build a Junction City facility because they need the space for patients, mental health patients. But there's a lot of feeling about it should be done in the community rather than locally, but it has to be funded. The big issue always is money, coming down to how we're going to spend our dollars. And I do appreciate the positions that this organization has because they're general, and so we use a lot of those positions to advocate at the state level. And the more general they are, the better. But then we find sometimes that we don't have a position. Like we haven't had one on schools other than school financing, so we haven't been able to say much about the school and the education issues. But there's going to be a federal study, so that will help us a little bit. And then there's a new education bill that passed, which was Senate Bill 909, and it's going to set up a early learning council. So it's going to take some of the human services into that educational arena. So we'll have to get involved in the education hearings too. So that's another group to follow. And one thing that concerns me is that our process of doing studies is very rigid, and I think in some ways we need to do them quicker so that we can respond to things faster, and we need to find a way to get our information together quicker, and so that we can handle more studies and get more positions, and particularly we need to use other people's information, maybe, and do more research in a quicker fashion. And I think actually the League of Women Voters of the U.S. is doing that now. They're getting a lot of positions and papers done, probably in a briefer format and a quicker turnaround time. And I'm also pretty adamant about being nonpartisan, because I don't like to see us line up with one party or the other. And that is very much noticed by legislators. You know, if they see us do anything like that, you know, they'll put us in the pocket of one party or another. So I think we have to just be so careful with being nonpartisan. It's probably opened my mind to a lot of issues that I would not have gotten into. You know, I definitely tend to do the social service kind of thing, but I think it's probably opened my mind to different issues, and it's probably also inspired me to learn some other skills, like handling a public meeting and speaking extemporaneously in front of a crowd. So, I mean, there are things that you learn from being in there too. And it's intimidating, like going to the legislature and testifying in front of the legislature. But after you've done it for a while, you kind of know what they're looking for, and it becomes more comfortable. So you just have to get out there, you know, and try some of these things, which maybe are uncomfortable at first, but after you learn the routine, then you know, you learn the ropes, and it becomes more easier. And then sometimes you find out that you actually made an impact on some things. Like I think this session, we started out with saying that because of the economy, they needed not to make cuts in some of the human services because there were people who were going to be, you know, without food and housing, and, you know, so they needed to keep those programs. And they have, you know, that is one of the things that they did. And maybe they would have done it whether we said so or not, but it doesn't hurt, you know, to get your ideas in there right off the bat. So I know that was one. And I have testified on a lot of the children's issues. So, you know, it's just, you sometimes just have to remind them of things that are important that they should keep in mind. So anyway, it's a worthwhile endeavor.